There's several ways that this happens. Now there are polygenic risk scores that are available on the market. They have nearly 500 markers. There are these little, so all of us have different versions of the same genes in our bodies. The cameraman behind this camera is a male, and we are genetically more similar than me and my own daughter because of our shared Y chromosome and me lacking in the X chromosome. So I'm related to almost every other male in the world more than I am to my own genetically related females because of that. And so that makes an interesting way of thinking about these diseases. So we're very, very similar. But these polygenic risk scores will show us that populations that have higher rates of prostate cancer also have more of these these genetic polymorphisms in their DNA.
Yeah.
And so if you are lucky enough to get yourself tested with a polygenic risk score and you find yourself in the highest 10% or 5% or top 1% of having these risk scores be high, like if your score is in the top 1 percentile or top 10 percentile, it means that you should be screening more frequently. And so folks who do know that do tend to be more aggressive with their screening. They don't work as well in African American and other Black populations because the studies that made those risk scores tended to not have enough of them in there. And so we're not always sure exactly of if this actual variant is actually the one that's related to increased risk in Black patients. So that is still being worked on. Chris Heyman, Ann Hamilton, and others have been working on amassing large amounts of Black men with prostate cancer to answer this question better. But currently their data looks at whether or not you have any prostate cancer. And what we really care about is if you have risk for lethal prostate cancer. Because a lot of people have prostate cancer and never die of it and don't even know that they have it. And it would be better off if they never knew. And so right now we're needing to get a little bit better with our polygenic risk scores.